Can you give us some details on the business that you have, the treatment center that you have, and just how you got into some of that?
Sure. So I'm the CEO of a company called Beond. It's spelled B-E-O-N-D. Beond operates a platform for psychedelic-assisted treatment for chemical dependency, depression, anxiety, and trauma. And we operate facilities in Mexico because Ibogaine is like cannabis is a federally Scheduled I substance in the United States. So we can't operate legally in the United States to provide this medication. It's a residential facility. People come, they stay with us. They're treated by licensed, credentialed physicians, ICU certified nurses, psychologists, nutritionists, a bunch of other very dedicated professionals. But the key innovation is the use of Ibogaine for the compounding of the other psychotherapeutic benefits that are derived throughout the process. And the way I got into it, well, I'm a recovered drug addict and alcoholic, so I spent a lot of time denying that and learning about that through practice, wrecking a lot of relationships and really making my life incredibly difficult, despite success in certain other areas. But I got off that stuff and began to live differently in a more conventional way. Went to 12-step programs, worked through a process of what I call awakening, where I had something better than substances. But someone in my life was a opioid addict. They were prescribed prescription medication called Vicodin for a dental procedure in their late teens. And it hit them the way other substances hit me, which was, it wasn't just about getting rid of the pain. They loved it. They couldn't get off it. They eventually couldn't get enough of it legally, and they turned to intravenous IV use heroin to have the same effect. Then went to upwards of 9 different conventional drug and alcohol rehabilitation centers in the United States, spent nearly $1 million in copays. And somewhere after they did what they were told and followed the program appropriately, they would relapse. And a friend of theirs who was also a using buddy had discovered Ibogaine in Mexico and said, "You got to try this." Well, the person in my life did. They went to Mexico, they went to the place. And in about 12 hours of this intense psychedelic experience, they had no withdrawals, no cravings at all. And they ended up free of that habit, free of that behavior. However, the place itself was horrible. No medical infrastructure, no preparation, no nurses, no doctors, no therapists. And they literally escaped from this place after the treatment. And at one point in my life, I made a promise to them, if I ever could, I would try to build the place they should have gone, that would have the right infrastructure, the right delivery model, the right philosophy and approach, because it worked. I saw it work. I know it to have worked. And I really believe that people deserve, especially when they're most vulnerable, when they want to change, the type of support they need to take full advantage of that. So in 2020, I started researching what would need to be true for that place to exist from a legal perspective, from a medical perspective, from a psychological perspective, and of course, from a hospitality perspective. What would it need to feel like for me to be willing to send someone I love? And in 2022, we opened in early 2022.
Bad Project family, how's it going? Now, as you guys know, we have been talking about cold therapy for a while. Mark, Andrew, and myself, we all use cold plunge XLs since we're pretty big. But the cold plunge is amazing. And there are a lot of cold therapy tools out there. Obviously, you can use your shower. But the amazing thing about the cold plunge is, number one, it doesn't take up much space in your home or your backyard. And number two, you don't need to change your water, unlike other cold therapy devices, for 6 months to a year. It filters itself. Let's not even talk about all the benefits of cold plunging, like the dopamine release, how good you feel after doing it, and just the cascade of hormones that happens after you get in some really cold water. It's crazy, and we love it. So, Andrew, how can they get it?
Absolutely. You guys got to head over to thecoldplunge.com, and at checkout, enter promo code PowerProject to save $150 off your very own cold plunge. Again, thecoldplunge.com, links to them down in the description, as well as the podcast show notes.
What does this kind of treatment cost? Like, what? I'm sure there's different levels depending on how much care you get, how long you stay. What's kind of like the minimum dosage? You know, someone can go, like someone just goes there for a week, and what kind of cost may they incur?
Yeah. So it's, the cost ranges from $7,500 for 10 days. So it's average 10 days. So we don't charge by the day. We charge by the treatment. So the average is about 10 days. And the reason for that makes a ton of sense. Like, you arrive, you need to get ready. So we do all our own labs, all our own blood work, all our own medical assessment, psychological assessment, largely to verify what we've already done remotely. So everyone's already filled out incredibly detailed health history, spoken with a certified psychedelic coach, probably spoken to our physicians and psychologists before they left their house. Then they come here, we want to verify everything, because we don't know what you did last night. And sometimes there might be things you didn't report that are important. Like, you didn't know that certain types of health conditions exist. So we want to make sure we are seeing what we want to see to ensure your highest level of safety. That takes a day or two. And then we talked about the psychedelic agenda. Like, most people don't show up with that pre-written, and they want to get oriented. They want to kind of go through a process of being prompted. Like, okay, help me understand how deep is deep and how wide is wide, and what's this going to mean? What could this mean, et cetera. So again, what they came up with, what they arrived with thinking, is beginning to evolve. And then the treatment itself, when they feel ready and they are ready, it's like on day 3, 4. There's no rush. Like, to go fast and to go deep, it just feels to me like counterintuitive. We want to be safe. We want it to be lasting, healing, and change, right? So there's much more work that we could do before people come that might accelerate that front phase. But most people are not ready to do it. They're like working right up until the airplane. They're rushing to the airport. They fly down. Come on. So people that work with their own doctors and their own psychologists, we get a lot of referrals from doctors, a lot of referrals from psychiatrists and psychologists. And of course, they might have done some more work, but it still doesn't eliminate that phase. So that's 4 days. And then you do the Ibogaine. It takes all day, sometimes all day and all night. The next day is, you're wrung out. You're not doing much that next day. You're kind of like parked or in a puddle on the couch. And it can be very emotional. It can be very hard, is the word I would use. Like, it's not a recreational experience by any stretch of the imagination. So there's that day. That's day, say, 5, roughly. Then you've got 3 days to do the introspection, the aftercare planning, the life visioning, the sort of insight, understanding, and turning that into like a plan of action. Like, insights without action are just like, they're just ideas. Like, I should quit my job and become a poet or whatever. But yeah, I've got to go back to work as a litigator. So we'll put that on. That's not the goal. So it takes a few days to do that. And frankly, it's not like boot camp, right? So we're not like get out of bed. You owe us something for your own benefit. You owe us something, some workshop. We facilitate, and it's definitely structured and it's definitely designed to discover and reveal the things we need to use in the agenda setting, the treatment, and the aftercare, and the aftercare planning, because you leave with a written document that is the kind of roadmap of the change that you wanted to see. I think that roadmap is worth $7,500 because it's pretty accurate and it's deep and it's meaningful. And you can, one of the things I like to tell people is, when they ask you, you get home and your loved one says, "So, what's your plan?" You can literally hand it to them and go, "Here it is." And then you can retort with, "What's your plan?" But the range of prices, 7,500, 10 days, 9,000, still 10 days, and 11,500. And here's the trick. Because we can only do right now about 20 treatments a month, what I tried to figure out was, how do you be fair? How do you incentivize people to pay, but pay the lowest amount? And then have capacity for people that aren't ready to make a decision. So the first 10 people that commit in any given month pay the lowest price. And then the next 5 pay the medium price, 9,000. And then when all those 15 are sold for that month, there's 5 left over for people who really need, they don't plan. They want to come right now. And of course, they have to be evaluated. But, they're, for whatever reason, unable to plan in advance. And it's either urgent or whatever. They're on tour somewhere. They're like a lead singer in some band, or their movie's not over yet. They want to come right now because they go back on tour or something. That happens. We can accommodate that. But I don't want to disincentivize people who can plan and want to save by charging them all the same amount. And I think that's the fairest way we've come up with to do pricing. And someday, obviously we'd love to lower the prices. We'd love to be able to provide specialized services, extended care, which might increase the price, et cetera. There's a counterintuitive idea, which is someday insurance might cover this. It might be in the United States. And it's always assumed to be a good thing. And then I remember the story my mom told me about going to the hospital. She's like almost 90, just over 90. And she was a nurse her whole life. And she was like, it's hell. Like she has a reasonable amount of means. She didn't go to like a veterinary hospital. She went to a normal hospital in her town. But the people were disincentivized to really take time. They were cost cutting everywhere they could. It just seems like the involvement, obviously everyone should have access to quality medical care. I believe that to be true. And some people don't have the means, and they deserve to not have to be exploited or not get it or pay what they can't afford. However, and we should offer insurance for that, but when insurance reimbursement is the goal of a business, it seems to really turn it into a mess for the people who want to go to work in care and the people who really show up needing a different type of care. It's not just McMedicine, no offense to McDonald's. But.
Hey guys, if you like this clip, go ahead and comment down below and let us know what you liked about it. All right. Share this with a friend. Make sure to subscribe to the channel. And also, we are on Reddit and Discord. All that's down below. All our sponsors and everyone that supports us down below there too, so you can get whatever you like from us. All right? Peace.